Hello, everybody. Thanks for joining today's webinar. We'll be getting started in 1 minute. All right, looks like everybody's filtering in here. My name is Corey Mullins. I'm going to be moderating this webinar today. It is Healthcare Security, Privacy, and Compliance in the Age of AI. We have a lot of great information prepared for you today, and our two speakers are Joe Gellatly from Medcurity and Demi Borden from iatricSystems. Joe, I'll pass it over to you to take it away.
Thank you so much, Corey, and thanks everyone for joining. Looking forward to sharing with you over the next hour or so, and I'm happy to be joined again by Demi Borden from iatric, and we've done this before. And Demi, thanks for presenting with me again.
Glad to be here. Thanks for having me.
So I will jump in from the security side first, and as Corey said, our theme here is how artificial intelligence is impacting security and privacy in our healthcare organizations. And we're going to take you through a few different key areas to be paying attention to, both in the security world first and then in privacy as well. And I'm just going to jump in here and talk about a bit about AI in general and take it to cybersecurity. And so those that don't know or don't work with us yet, Medcurity is focused on the security risk analysis that's required under HIPAA. So when we look at AI, we're looking from the lens of the risks in adapting AI tools, and then the threat landscape when it comes to breaches, security breaches, and how that's shifting as well. So we're going to be your most paranoid person to talk to. I'm going to be your most paranoid person to talk to on this. We work with healthcare organizations around the country and have these conversations daily. So we're seeing the various levels of adoption that are happening right now with AI tools. So let me just start at the top, and then we'll get into some specific trends and themes that we're seeing. So primarily the innovations happening around AI has been in generative AI, maybe more than any other type. So that's more like it's a supercharged autocomplete type of function. And that's what we're seeing in like ChatGPT and Grok and other Gemini, other tools where we can interact with the AI tools. And they're powered by and built on top of large language models. And that's that again is a form of AI. There are, of course, others that have been around for a while that are used in analyzing lab results, analyzing images, various forms of AI that have also started to be adapted more rapidly as well. But most of what we're going to focus on would be the generative text creation analysis type of AI right now. There's certainly a lot of aspects of how this is being built into our healthcare organizations, but let me highlight a couple. And some of you may have already adopted tools on the transcription side or the scribe side. So we're seeing maybe the most uptake in AI adoption has been in putting in tools and adopting tools that will take that scribe component out. So listening in on the encounter and then completing the chart, notes and the encounter notes for the provider, maybe queuing up orders. And that has been, I would say, very successful. And I mean, maybe it's different stages of implementing that, but if you haven't started that journey, the providers that we talk with that have that in place, it don't sound like they're ever going to go back. So even if they're not a big technology enthusiast already, the efficiencies that the scribe technology bring in have already just really been proving out very quickly to really be changing the workload on the providers, allowing them to focus more on the patient. So we're seeing that obviously take off. We're also seeing some RCM tools for supporting coding or claim scrubbing or various aspects of RCM being implemented pretty successfully as well. And then just a lot around messaging and other types, again, of analysis that we can do with this. So I think maybe just one quick takeaway as we step into this is it's good to know where the AI footprint is right now for your organization. So if you haven't looked at maybe even just website activity, if you're a little bit of a large organization, how much traffic is there at the on ChatGPT or Grok or others, and have an understanding of how your employees, your providers, your team, how they're using the AI tools at this point. So we have to, as we look and are going to talk about the risks and rewards here, we have to have an understanding of current posture. And again, as Medcurity focuses on the SRA, the security risk analysis is a great time to have those conversations and take a look and say, okay, so do we need to put a policy in place quickly if we haven't yet? Is the implementation of AI happening without structure and just rapidly being used already for letter creation or research or marketing or other things that we do, functions that we have as an organization? Start with understanding where it's at. And so a couple things out of that, you may find that you need a policy quickly and put, not to restrict it completely, but putting some guardrails in place. But you also might find some champions that are just ahead of the curve and might be helpful to the organization in starting to adapt AI tools. So again, just understand the current posture. Of course, the reason that we want to be focused on this is there is a lot to gain with these tools that are coming out, both productivity, also the analysis side, the research side is tremendous. There also are huge risks, and we have a lot of examples already of tools that were just downloaded and put in too quickly, and those are happening in healthcare and outside of healthcare, where they maybe we're just grabbing it because it's cool and it can create images, but really quickly, but we don't actually know who created it. It was built very quickly without security controls put in place. So software, especially, is moving very quickly right now, and so we are going to talk about that. I recommend having a policy in place of what's allowable and how you as an organization are going to kind of control but continue the adoption of these new tools. And final bullet point there, regulatory uncertainty. We're starting to get some guidance on the regulatory side, but right now we're mostly just applying the current security rule and privacy rule to everything that we're seeing happen in the market. So just to underline that a little bit more, there are threats that are occurring because AI is enabling it. I think we can get into that a little bit more here. So we are seeing a faster turnaround of attacks, right? So stepping into cybersecurity briefly, the types of breaches that are occurring for healthcare organizations, we're seeing an escalation in phishing, which has been the dominant form of attack for a long time, but phishing has gotten far more effective with the advent of the AI tools to help with that wording and help target wording. And I'm sure that everybody here listening in has seen this to some extent. I received an email today from one of my colleagues that it looked like a forward from my account saying, hey, has this invoice been paid yet? And then somebody forwarded it on to a coworker of mine saying, hey, Joe's trying to get this invoice paid. It looks incredibly realistic, especially compared to phishing emails from 3 years ago. So, one of the threats is just the need to have a really high sense of paranoia and awareness, and being having zero trust in your emails until if you're being asked for any kind of financial information or financial transactions or credentials or anything like that. So again, you've probably all seen that, but I think it's worth pointing out that we need if our employee is trusted with email, they're trusted with being a front door to our organization. And so they need to have a high level of paranoia right now. And all the filtering and tools we can put in place to protect them, there's still going to be things to get through. And so we need to be training. We haven't adjusted our training and our awareness that we do with our staff and team meetings and newsletters. We need them to be aware of what phishing emails look like. Phishing simulation software obviously is tremendous toward helping people's awareness grow. So we need to, if we're using that can help a lot. Voice cloning is very impressive as well. And again, in our organization, just to be on top of this and ahead of this, we've used some of that AI voice cloning experimentally, and it's incredibly impressive. So one of the things that Medcurity is focused on, we're building out a phishing simulation software that can include voice cloning, so we can train staff on being aware of phone calls and how I think one of the easiest takeaways is how you really should hang up and call back if you're getting a call from your bank asking for any financial information. If you're getting a call from anyone asking for financial information that you don't, well, I would say if you don't know if you don't see their phone number and know their voice, all the identification you can do, then it's worth calling them back on the number you have for them to ensure that you're talking to the right person. So it's speeding up the cybersecurity defense side too, fortunately, allowing us to do more monitoring, to identify threats quickly, and even to review our policies and our contracts in an efficient way. And so those are great things to empower your IT vendor, your IT department with, if it's internal. And from my experience on the Medcurity side, we do network vulnerability assessments for our customers, and we can take a tremendous amount of information from a network vulnerability assessment and distill that down to the key focus areas, using AI to do that for us, and then even put that on our platform so our customers can manage those action items. And so we can take that concept applies to a lot of places in healthcare. We can take a tremendous amount of information now, and instead of having staff for weeks or hours work through that information, we can analyze it much more quickly and pull out action items and key focus areas. And that's super powerful for our hospitals and clinics now. Just a little bit further highlighting some of the threats that we're seeing. But again, the phishing really continues to be the leading issue. We also are seeing credentials being stolen on less secure sites, and we're seeing our vendors be highly targeted for being in healthcare adjacent even. So we wanted to have our vendors held accountable to completing their security risk assessments, to making sure we've got a current business associate agreement in place with them to hold them accountable. And we're taking steps to protect us as the landscape evolves very quickly here. Seeing lots of the cyber attacks, and another way to look at this attack surface really quickly, just to keep everybody aware, is on the Office of Civil Rights breach portal. There's a list of all the breaches that occur that are over 500 patients in impact. So more than 500 patients are impacted. They're put publicly out here. So this isn't to call out any organization specifically. This is just pulled from the website that's publicly available. And when you look at that, you can see the trend, and you can see that by and large, the types of incidents that are happening are cybersecurity related. When we started Medcurity years ago, just prior to the pandemic, there was a breach that would occur at once or twice a week. Now it's twice a day, and the incidents were pretty well balanced. There were, a mix of types of incidents that would occur, and now cybersecurity is hacking events are really leading that out. And then we're seeing snooping issues and improper chart viewing, and access controls needed internally too. And we'll get more into that in a bit here. One of the key focus areas, or maybe the key focus area for the Office of Civil Rights, when it comes to holding us accountable to what we're supposed to be doing today in this landscape, they're all looking for that security risk analysis. So obviously, if you're working with us, we've got that covered for you. But that's very important to have that available. These penalties that are being handed out by the Office of Civil Rights are tied to not having a security risk analysis done. And they said 90% of the time, we're seeing it in just about all of them. If they come in, if there was a breach of some sort that occurred, whether it was internal threats or external threats, they're asked to show their SRA. If they can't show the SRA, that's typically what leads into a penalty situation. So remember to make sure any events are reported quickly, have your SRA done, have the policies completed to speak to that. I'm just going to highlight a few things here to keep in mind, again, in the current landscape. With us or with your IT vendor or whomever you use, that network vulnerability assessment is really critical. As AI has really accelerated development of malware, of any kind of software, when new vulnerabilities are found in the software we use every day, the exploits or the bad guys' tools to take advantage of those vulnerabilities are being built so much more quickly. So it has become very important that we are on top of the ongoing patching, and that we're doing NVAs or network vulnerability assessments to find systems that we've missed, that are out of date, that don't have the patches. We also look for accounts that shouldn't be active anymore, or user accounts sharing passwords. There's a lot of things to look for in an MVA. There's always a few things to jump on quickly out of that. But it's a good idea to have that occurring at least annually, if not quarterly, and then having ongoing monitoring with your tools that are in place as well. Obviously, security and training is a big issue right now. Just having your staff be aware of the type of phishing and voice calls, phishing, smishing, all the types of attacks that are occurring, and how realistic those can seem. The sense of urgency, the impersonation of people that they know and work with. It's good to have everybody just be extremely aware of that. Have protocols in place to verify and validate before any credentials are shared or financial information is shared. And we really recommend, incident response drills. It's part of your HIPAA requirements, but it can be done in either a very thorough, comprehensive way, or even a quick tabletop. But that would be an activity where you pull your team together and walk through an event. So in this case, potentially a ransomware attack would be a good one to walk through and say, okay, so if the system is unavailable, who do we call first? Do we call our cybersecurity insurance provider first? Do we call the FBI? Do we call our IT vendor? What does that process look like? And walk through that, role play that out if you haven't recently. We work with organizations that do this in a very thorough way on an annual basis, and others that haven't done it for a while. So just if you haven't done a drill, a tabletop exercise around an event, highly recommended. It really does help prove out where your policies need a little more attention, or where the roles are well defined and everybody knows what to do. The other areas are hopefully pretty well in place. I think just closing with a culture of compliance is a good point. So just encouraging everyone to raise any issues. If they see some odd behavior on their workstation, they should be coming to you quickly with that, and know that you're going to come alongside them and help work through that. If it's a workflow issue where they were in handed information out they weren't supposed to, or in charts they weren't supposed to be in, but it was because of a workflow that just went sideways, we want them to bring that to you and say, hey, that you're going to come alongside them again and help improve the processes. And obviously there are people issues, there are internal threats, there are external threats, but much of the time it's process issues. And so we always encourage a healthy culture of compliance. Walk through your clinical areas and coach to how to implement privacy controls, security controls. And if you can do that on an ongoing basis, then your annual security risk analysis, where we walk alongside you through those clinical areas, goes a lot more smoothly, and the organization is usually very comfortable with raising concerns and issues, and it helps you stay ahead of those as they come up. We always recommend on the cybersecurity side that we have multi-factor authentication in place, and I think nearly all the organizations we work with have it nearly all the way in place. So at this point, it would be any remaining remote access, remote portals that don't have MFA turned on. It's almost always on for email, but what we have found is that cybersecurity insurance requires MFA. So most organizations have said, yes, we have it. But then there was just recently a city that had a ransomware attack, and they had MFA turned on. They told the cybersecurity insurance provider it was on because they had it on for email, but they didn't have it on for a specific remote access portal. So the cybersecurity insurance provider denied the claim, very expensive, somewhere close to 20 million in remediation that was denied because they didn't have MFA fully on. So be aware, if you're telling the cybersecurity insurance provider you've got it fully on, ensure that there's no other portals or systems you've got left that are not using MFA. And of course, we talked about patching and keeping your systems current and updated. And then there's more we can get into. When we do our MBAs, we can get into network segmentation and protecting all of your assets. Because of the changing landscape, risk management's really critical right now. So whatever tool you use, these are screenshots from Medcurity. So this would be a very rough risk review at the beginning of a year, potentially. But you want to be able to see across those threats. We're required to be able to show the Office of Civil Rights that we're measuring our risk level on all these threats. And then through the year, as you finalize MFA, as you provide education to your staff, as you complete your MBA and your action items, those those orange and red areas start dropping down to yellow and green. So again, this is how it works in Medcurity, but if you use a spreadsheet, whatever tools you use, it's extremely critical to stay on top of risk management. We have to show we're doing the security risk analysis and we're doing risk management, and we're remediating those items that come up through the year. And then we look again and say, okay, so everything that changed in the past 12 months, new locations we might have, or new staff, or new systems, and then the attack surface changes too. And so you're looking again each year, measuring it, and just make sure we're keeping risk down to an acceptable level. That's closing out. Basically, the theme here is to ensure that we are tracking that work. So again, if it's not in a platform, just ensure you have proof that that SRA that was done is being managed through the year. But Medcurity makes it easy, but it just needs to be documented in some way there. So I think that will take me to the close of the security side. So Demi, with that, I'm going to hand it off to you.
Thank you, Joe. Good information and some good takeaways from all of that. But kind of sliding on over, while Joe has been speaking on AI and its risks and rewards regarding more external cybersecurity threats, I'm going to speak more about AI and its risks and rewards in managing internal threats when it comes to patient privacy. So managing patient privacy, it can seem like a really daunting task. There's a lot of data bouncing around in multiple systems in a lot of organizations. So a lot of the time when it comes to patient privacy, teams don't know where to start, or they feel like they're one step behind, wondering what it is they're supposed to be looking for. And a way to get a little bit more clarity is by taking a step back and identifying what it is you're actually doing right now. Are you being proactive in trying to identify any inappropriate accesses, or is it more reactive, where you begin investigations only once a tip or a complaint is called in? Also, what tools does your team have now to identify inappropriate access? A lot of the time, this is a very manual process. Your team's pulling very general access reports from your EHR that seem to have endless data coming in. They're sifting through every access, trying to see if there is an anomaly that needs to be investigated. And when they do identify an access that needs deeper investigation, now they need to pull a separate report on that user, possibly across multiple systems, and that user has access to all those different systems, and try to piece together a timeline and a picture of what was accessed and why. But that takes a long time for your team. So how do you get your arms around everything that is going on when just finding one anomaly takes up so much of your team's time? And this is where you need to start thinking about how to work smarter and what technology is out there to help you land on top of this, what I call mountain of privacy. So on this next slide, we'll see what people are actually doing and what could be a risk to privacy. And I like to explain it in the 3 C's of inappropriate access. And these break down behavior of risks into groupings of carelessness, concern, and curiosity. So for carelessness, this can be things such as PHI accidentally being added and sent to the wrong patient, or maybe a proxy was added to the wrong account. As patient portals have become such a norm, it could even be adding results or notes to the wrong portal. And these types of actions, they happen. This is human error, and the best we can do for these types of actions and keep it to a minimum is to correct by intervention. And that can be through regular education and reminders of how to properly document, track, and link information of patients. But in the next pillar of concern, it's kind of a step up. We have accesses that people make out of concern for the health of their loved ones or for themselves. And these are a lot of the time more of policy violations than breaches. And this is going to be users looking into their own records, checking up on appointments for themselves or for loved ones. This could also be checking lab results or notes for a spouse or a child that is being cared for. And people can feel as though this isn't really an issue, especially if they have full access to that portal of that loved one. They may feel that because they have permissions there, it's not a big deal for them to just quickly peek at the charts within the EHR itself. And that can kind of lead a gateway over to the final pillar here, which is curiosity. And these are much of the time true HIPAA violations and breaches. These lead to reported concerns and internal investigations. So this can be checking in on that coworker that called in sick or you heard was down in the ER being seen. Or maybe there's a VIP patient that was in an accident that is all over the news right now. It's that friend or neighbor that you saw in passing on your way into work, and you're just curious why they're there. I've even heard from a customer about finding someone who is screening the health records of their potential dates, just to make sure there wasn't anything nefarious there. So there's a lot of things and curiosity that could get you in trouble there. And with that being said, we're in an age of instant gratification. We have everything we could ever need or want, all that information right at our fingertips all the time. Um, we're in habits of just pulling out our phones, getting answers right away. So it makes it tempting to get these types of answers to those curiosities when you have the access to get it. It's not paper records shut behind a locked door anymore. It's you put in your login information, and for the most part, you can see a lot of stuff that you shouldn't be seeing. So on this next slide here, what is it that you can do about these things? Well, the first step should be to review what your current process is. Use those questions I was asking earlier. Identify if you have a more reactive approach or a more proactive approach to privacy monitoring. A lot of the times when you don't have any solution or system in place to aid in your investigations, you're leaning in the direction of auditing fairly reactively. You also need to start looking at those 3 C's that are going on in your own organization. What types of issues do you hear coming up often, or what situations have you not thought about before, but you want to watch out for and prevent from slipping under the radar? So you can use those 3 C's to help you identify what types of accesses may be policy violation versus what would be considered a true HIPAA violation as well. This is also a good time to start reviewing your policies. Are they clear and communicated thoroughly to your staff? Are there any policies that maybe need to be adjusted or altered to help everyone to be on that same page? What type of education of these policies do you offer and how often? You should also take care to make sure your team and staff have a clear picture of what to do with any types of incidents that do arise. I mentioned a moment ago that we need to start thinking about how to get on top of the mountain that is privacy. And a mountain to me is a really great analogy for this. Because if you picture privacy as this mountain and all the data and flow you have around the mountain is the departments and the people that you need to keep a watchful eye on, you don't want your base for privacy to be at the base of that mountain, too. That means you're just running in circles trying to keep up with everything. Having technology such as a patient privacy monitoring solution and all that comes with the AI, machine learning, that's a major tool in your team's belt and helping them rise to the top of the mountain and get that bird's eye view of what is going on around them. And it gives them the tools to tackle anything that they may spot from up there. So this will lead you to uncover trends, take you on your way to better educating staff, preventing repeat occurrences, and so on. So what is this magic technology for your team and what tools does it provide for you? Well, on this next slide here, iatricSystems and Haystack itself, we have a patient privacy monitoring software called Haystack that uses AI automation to help you uncover suspicious behavior. That way you aren't spending those countless hours sifting through that data. It's finding that needle in the haystack for you and bringing it to the forefront for you to investigate. Another perk of solutions like these is having the option to automate certain tasks. With Haystack, for example, you get an advanced virtual assistant called Ava that you can assign to watch for certain types of accesses and automatically send up follow-up emails to users and managers, ask for more information, and this can really streamline repetitive tasks that bog down teams. That way you can focus on tasks that can't be automated and spend time uncovering and managing those trends. So how does the AI in our products work? Well, I'll start this off with how AI is not used. We don't use AI to replace human judgment. AI, it's imperfect. We have all probably heard of instances where large language models, for example, start to hallucinate after being asked to find a solution over and over again, with it never being the appropriate answer the person asking was looking for. We don't want that when it comes to privacy monitoring. There's confidential information on the line. There are sometimes people's jobs on the line depending on the investigation. So these things can't happen. Now, this isn't prevalent everywhere. It really depends a lot on how the AI was trained and how the vendor uses their AI, but that's why AI shouldn't be the end all be all when it comes to privacy investigations. So how do we use AI then? Our AI identifies items of concern for human decision making. We make connections in the data so that your team doesn't have to spend hours making those connections themselves. It will help identify when users make accesses that are atypical to not only their own workflow, but also the workflow of others in their same role within your organization. There's geolocation that can help you identify neighborhood snooping compared to user and patient addresses. And the AI and machine learning will also score these actions in relevance to how risky the behavior that was identified is. But again, this information, it's handed over to your privacy team to review instead of the AI marking these things as appropriate or inappropriate without that human review. So we also use your data within your own environment to feed our AI model and learn from it. Every customer's data and environment is different, and that can be because of different things such as geographic location, different types of hospitals. So, for example, a small hospital in a rural town has a much different set of patient demographics and user demographics than a large hospital in a major city. Each customer will have different name distributions for same last name accesses. Small town hospitals will see that coworker access is more likely than when within a city. High profile patients are more common in some hospitals than in others. And because of this, we don't train our AI using every bit of data we have across our customer base. We train it in each individual situation because each organization has their own workflows, demographics, policies, and the AI needs to learn what's normal for each organization individually. So how do we weed out false positives? Well, to put it a little more simply, we take all the demographic information into account. So for self-access, as an example, there may be a lot of John Smiths in your data. We have to look at more than just the same last name. We have to look at birth date, social security number, gender, all these other pieces to the puzzle. Another thing we do is we learn from the feedback of the auditing team themselves. Items that move on to further investigation helps our machine learning learn that is on the right track for marking the correct items inappropriate. But on the flip side, machine learning within the systems will also watch what types of accesses your team deems appropriate and help to filter those out in the future. So we've looked at what's happening in healthcare organizations around inappropriate access, the data that's available to uncover suspicious activity, and how AI and automation can help. But the big question is, how do you get started? Well, step one, it's realizing you're not alone. There's partners out there such as Medcurity and iatricSystems to help guide your team every step of the way to stay compliant. There are a lot of solutions in the market, and choosing the right one starts with asking the right questions. So, first, are they experienced? Just as at iatricSystems, for example, we've been delivering healthcare IT for over 35 years, specializing in patient privacy itself for more than 20. So this isn't new territory for a company like ours. It's the core focus. And the benefit of doing this for so long is no matter system setups, we've seen it and we know how to help. Secondly, you got to ask about the AI. AI has become such a buzzword. You'll even see toothbrushes marketed with AI these days, but is it real machine learning? How is your data being used? And can you truly trust the partner behind it? These are really critical questions to talk through with the vendors that you're selecting. And finally, you got to make sure the solution actually fits you. Every hospital is unique. That's why we built our solution to work seamlessly across any environment. So now on to the next slide here. You've given your team the tools to succeed, freeing up time and resources. Your team can start really focusing on the data that they're collecting with these investigations. They can start tracking case details, locations where certain inappropriate accesses occurs, relationship trends, turnaround times, and you can start tracking what types of breaches are occurring the most within your organization and keep up with reporting to leadership or government agencies. Having all the information you need to track and manage trends in one place keeps things really organized and your team working efficiently. So by tracking these details, you will start to see the bigger picture of the what's and why surrounding incidents in your organization. So for example, tracking types of breaches can lead to having better education for staff regarding those issues. Tracking relationships can help you better understand your staff and community. Is it all family snooping? Is it friends, coworkers? Tracking location can help dial into areas of your workforce that have a higher investigation rate and therefore may need some supplemental education. Use it to determine who are frequent offenders and where they're located. This can also help build timelines for when education will have the largest impact. So, for example, speaking to a privacy team, they told me that they noticed a spike in family access right around the holidays. And using this, they scheduled education sessions in September and October so that it's fresh and front of mind for those users leading into the holiday season. I think that's such a fantastic way to use this data that you're collecting. You're not just writing it down, you're using it. And another way they were able to use those trends that they found is they used it to help with overall program planning and effectiveness because if they knew that there were spikes in inappropriate access toward the end of the year, they can then schedule projects for the beginning of the year when things are quieter, therefore allocating resources in the best way throughout the year. So we've talked about the technology out there, how to use the data you collect, and now it's time for some best practices to kind of sum everything up here. And one of the main best practices to take away from this is to use your data to prevent breaches. Data can be used to review current workflows, discover any gaps you may have. You can take time to review your policies and procedures to see what is working and what should be adjusted. Next, you can find and use technology that is out there to audit access and get on top of that privacy mountain, if you will. Automate repetitive tasks, schedule implementations and projects you have coming up around those busier times, use that data to tailor education and so forth. You can use this but in determining all of that, you need to work with what you're doing. Don't forget to track your progress. This is a way you can fine tune what works or what doesn't work moving forward as well. So with that being said, I'll go ahead and hand this back on over to Corey now to answer any questions that may have been put in the chat.
Yeah, thank you, Demi. For our attendees, you could find the Q&A panel and send us messages on the right-hand side of the screen. Those come to us directly, so I will see them, Joe will see them, Demi will see them, and we'll answer them right away. In order to give you some time to type things in and submit the questions that you have, we did pull a couple common questions from customers in previous webinars, and the first one that I have is there's been a lot of buzz around the HIPAA security rule updates with the draft that came out. So, Joe, do you have an update regarding that?
Oh yeah, thank you, Corey. Yep, that has did create a lot of buzz. I think primarily as a marketing tool for a lot of organizations to say, here, these are coming soon. So there was a draft released in December. The new administration took over a couple months later, and there hasn't been further conversation about it. So I think it's worth having an eye toward it, but not necessarily attending, conferences that are dedicated to what's changing. It will be quite a bit of change, but we just have not had any indication from the current OCR leadership that that's coming soon. And probably most of the organizations we work with are pretty close to in line with those changes anyway. They were going to start requiring a network vulnerability assessment. There were just best practices from a cybersecurity perspective baked into it. So I certainly want to pay attention if we have any words of forewarning that it's coming back to the table. But right now, I think I think we know what the best practices are. Lots of things we talked through in this presentation were included in that. So work those in while you can now before they're set in stone in a rule. But also, I wouldn't start changing policies expecting that anytime soon. I think more of the focus is on removing regulations and adding regulations at the moment. So we'll keep everybody updated, but that's the latest there.
Great. Thank you, Joe. And this one's for you, Demi. I know we've heard from customers as well as just in conversations, a lot of hospitals are running audit reports through their EHR. What's the difference of taking that method versus using a patient privacy monitoring solution?
Yeah, definitely. So first, I'd like to reiterate kind of visualizing that privacy mountain again. You want to be up above what's happening. You don't want to be down in the dirt with everyone else trying to run after every single access that might occur. But also, when you're monitoring within your EHR itself and running those audit logs straight from there, you're only getting one piece of the puzzle. With monitoring solutions, not only our own, but others, you're getting a full picture with HR demographics brought in if you don't hold your HR demographics within the EHR. You're pulling in PACS, ambulatory. You're getting all the systems that those users might be accessing in one place versus running 5, 10 different reports to get the full picture.
Thank you, Demi. Looks like we had one question inside the chat, and I'll give a quick reminder that you can find that inside the Q&A panel. Please submit those as they come in. But this question is, what are typical misconceptions when it comes to HIPAA, security and privacy, versus potentially what's actually true? Joe, this one might be more suited towards yourself.
Sure. It's a fun question. Misconceptions, I think a couple that come to mind would be looking for some kind of certification when it comes to HIPAA and being compliant. And that's on the privacy and security side. There isn't a formal certification from the federal government around that. And it really is a journey. So when we see, anybody, organizations pursuing a seal of compliance or something along those lines, it's for, I think, a lot of people in the industry, it's a little bit amusing because compliance is such a daily journey, right? And the organizations know this, right? The privacy officers, security officers know that every day is you need to make an effort to be compliant. Your team, your colleagues need to do the right things. You need to be paying attention to the right things. But there are specific steps during the year to take, but there isn't a seal or official. We are fully compliant at any one time. We're always working toward it. We're always reducing risk. We're always working toward it. I think that's probably one of them. Maybe another would just be where the liability sits. I think just to underline really quickly, because it's come up recently, the business associate agreements are so critical, shifting that liability to your vendor. So if you have BAAs, if you have software tools that are downloaded, you start using them, or vendors that are brought to the table and you just have someone in the organization just hires them, we start working with them, and we're not ensuring that BAA is consistently signed before. It takes someone very hyper vigilant usually in the organization to watch this. What you don't want to work with an organization without a BAA in place. And the Office of Civil Rights is held to that. They will hold the vendor accountable. If the BAA was signed, they will hold the covered entity. They will hold the clinic accountable if there's no BAA and the vendor publishes information online accidentally or loses records. All these things that have happened, the liability shifts very, very consistently upon that BAA. So I think understanding HIPAA applies to us, to the clinics, to the hospitals, to the providers, the insurance companies. It only applies to your vendor once you've had them sign that BAA. Those are a couple of things that come to mind.
No, fantastic. Thanks, Joe. And it looks like that was the last question that came through the chat. So we're going to go ahead and close the floor for questions, but we know that the conversation doesn't have to end here. In fact, we encourage you to reach out to Joe and Demi on a one-on-one basis to get more information. And I believe, Demi, your information's on the next slide.
Yeah, like Corey mentioned, we'd be happy to extend this conversation outside the webinar. So feel free to call us at the number listed below, 978-805-4100, or email me directly, and we can get a call scheduled to chat.
Yeah, thanks, Demi. And from Medcurity perspective, we've got our support email on there. You're welcome to email me too. It's joeg@medcurity.com. I know we've got customers on here. Shout out to Hillary, I see you here. It's great to have customers joining, but anybody who's not working with us, if you don't have your security risk analysis done for the year, as we enter Q4, it's a very busy season for us, but we'd love to talk to you and about our approach. So just let us know if we can be helpful in that or anything else you're working on around security privacy as well.
And I'm going to add a little shameless plug. So one of the things that Medcurity is working on is a phishing simulator tool. And earlier, Joe had talked about the phishing campaigns and things like that, and the tools that threat actors are using to make those things more convincing. And I can tell you, we see these emails come through, and they're no longer full of spelling errors and things like that. They're very believable. And one of the things that we're working on is a new phishing simulator, and we've actually been testing it out on each other. And as a result of that, it's raised our own security awareness. And internally, we will take screenshots of suspicious looking messages and send them to each other. Hey, is this real? And stuff like that. So yeah, keep an eye out for that. And that just really underscores the importance of just kind of ongoing security awareness and training. Thank you. I think that's it, unless anyone else wants to add anything.
I think we can close
just
out.
a quick update on my side for anybody who's marking it down. It's demi.borden@iatric.com in case you get any kickbacks.
Well, thank you, everyone. We'll wrap up from there.
Thank you, everybody.
Thank you, everyone.